Today, as a new study shows, there is a way to combat common complications after treatment.
Health anchor Liz Bonus joins us now to share how new technology is helping with early detection. Liz?
Hey Paula, hi Kyle. Good evening once again to all of you. That new technology is what you see here. It is something commonly referred to as BIS, and this may help all of us detect what is common or what's commonly called lymphedema, and it may detect it early enough to potentially stop it. This is what lymphedema looks like. Teresa Anderson showed us her arm swelling on our Sunday morning What's Happening in Health show.
Lymphedema is fluid that builds up after having surgery for cancer.
Mostly it's tightness, heaviness, just a feeling of fatigue in the arm.
Both Teresa and Dr. Hillary Shapiro-Wright of Fort Hamilton Hospital are talking about this common complication after surgery because
I don't think that a lot of people even know what lymphedema is, and now I'm finding more and more information that there is help for this, and it's something that I wish I would have known.
She's right, there is new help, especially as this article from what's called the PREVENT trial shows. Researchers were looking at two things.
The first thing they were comparing is whether bioimpedance spectroscopy, which is an electrical signal into the extremity, can detect subclinical or underlying lymphedema before a classic tape measure evaluation. And the other thing they wanted to see was whether subclinical lymphedema treated early will prevent it from progressing to more clinical lymphedema or more evident symptoms.
Sure enough, researchers did find it helped not only discover symptoms better than just a traditional tape measure, but it allowed patients to get treatment that in some cases, Dr. Shapiro-Wright says, allowed for interventions that reverse the progression. Dr. Shapiro-Wright says there are two new options. The first is a surgery to alter the lymphatic system to change drainage.
The second, for more extensive lymphedema even, is where they can take lymph nodes, for instance, from the abdomen and transplant them in a breast cancer patient to under the arm to, again, help with those symptoms.
Isn't that remarkable stuff? Now, this new technology can also detect fluid buildup for other problems, even something like heart failure. If you'd like more information about it, or the study we mentioned, or Dr. Shapiro-Wright's surgery practice, we have a link to all those at local12.com.
From Local 12, the weather